Welcome to the IDC-IMPROVE project. My name is Dr. Joan Ostashkiewicz, and I'm a registered nurse and a researcher at the National Aging Research Institute, NARI. My team and I at NARI have funding from the Medical Research Future Fund to conduct a 3-year national project to support Australia's residential aged care workforce to deliver evidence-based and person-centred care to people with indwelling urinary catheters in aged care homes. The most recent analysis of data from the Australian National Aged Care Classification indicates that 8% of people living in aged care homes in Australia require catheter care. This represents just over 20,000 aged care residents. Many experience catheter-related complications such as infection, blockage, leakage, pain and hematuria, and are at high risk of being admitted to hospital and emergency departments for these complications. For the last 18 months, my colleagues and I at NARI have been consulting with people with catheters in aged care homes, their families, aged care employees and experts to design and validate a set of resources that could improve catheter care and uphold and protect the person's emotional well-being, independence, dignity, and quality of life. The resources could also help providers meet their responsibilities to minimise and manage the clinical risks associated with catheters. The resources, which we refer to as the IDC-IMPROVE Catheter Care Bundle, consists of a set of principles about catheter care that are mapped to the new, strengthened aged care quality standards, titled the IDC-IMPROVE Principles for Person-Centred Catheter Care for Aged Care Homes. There is also an online course for registered and enrolled nurses about person-centred catheter care, titled the IDC-IMPROVE Catheter Care Course for Nurses. We've also designed an online course for personal care workers about person-centred catheter care, titled the IDC-IMPROVE Catheter Care Course for Personal Care Workers. And finally, there is an IDC-IMPROVE Catheter Care Toolkit for managers and senior leaders. This includes the IDC-IMPROVE Catheter Care Audit Tool, the IDC-IMPROVE Set of Catheter Care Capabilities for nurses and personal care workers, and the IDC-IMPROVE Evidence to Practice Support Model. We've also partnered with the Continence Foundation of Australia to deliver site-based catheterisation skills workshops so that nurses can practice the catheterisation process in a safe environment. Now we want to bring the resources and the workshop to aged care homes in Victoria, South Australia and Queensland to ensure they're fit for purpose. This involves being part of a multi-centre, facility-level cluster, randomised controlled feasibility trial. If you are an aged care provider or are working in an aged care home in any of these states, we invite you to participate in the research project, which is titled the IDC-IMPROVE project. Please register your interest or feel free to contact me to obtain further information.